Hello, everyone. It's Michael Jones, and I'm here to talk to our medical exercise professionals and medical fitness professionals about the idea of the MedExPRO Operating System. This is the architecture for a medical exercise or medical fitness practice. And folks, we've learned this over the last 32 years. I started the very first medical exercise specialist workshop and certification back in 1994 in Washington, D.C. Well, now it's 32 years later, and our medical exercise specialists, as well as our post-grad conditioning specialists, medical exercise program directors, and even our medical exercise specialist advanced participants are now on 6 continents around the world, and you guys are doing a great job. But the one thing I start to see is you need to have a little bit better operating system, especially now. Folks, I guarantee you over the next 20 years, you're going to get busier and busier as a medical exercise or medical fitness professional. The reason? The baby boomers, the increase in chronic disease we're seeing across the board every place, the cutbacks in insurance reimbursement, and folks, probably one of the biggest issues is going to be just the changes that we're seeing in our economy and the changes that we're seeing in healthcare. As a result of that, the next 20 years, I guarantee you, will be a golden era for you, the medical exercise or medical fitness professional. But to take advantage of that, you have to have a practice operating system. Now, notice the term I used, practice. I didn't say business. I said practice. Now, as many of you know, I'm a physical therapist. I graduated from Howard University back in 1985 and practiced for years before I started the medical exercise specialist workshop and certification. And we did it because we saw that need to have someone to help bridge that gap between healthcare and fitness. That's where you guys come in. And 32 years later, it's actually still around. And the reason is because of the changes we're seeing in healthcare, the aging of our population, and the increases we're seeing, as I said before, in chronic disease. Well, that being said, you now have to step up your game. No longer as a medical exercise or medical fitness professional can you just simply know what exercises to do for a knee condition or a shoulder condition. It doesn't work that way anymore. Now you've got to be more engaged, more professional, and more involved, and you got to communicate with that doctor, therapist, or chiropractor, but you also have to have practice systems in place. Now, folks, when I started out as a physical therapist, I worked in a hospital setting, then in an outpatient setting, and about my 4th year, I decided I wanted to venture out on my own. So I opened my own PT clinic. Now, I was board certified in orthopedics, board certified in neurology. I was even board certified in sports medicine. And I had worked for a couple of professional NFL teams and NBA teams. So I was at the top of my game. But I can tell you, folks, when it came time to doing all the paperwork and all the administrative stuff and all the office management and client management stuff, I was a hot mess. My mentor, who was the director of physical therapy at the hospital, came by one Friday afternoon where I'm struggling with paperwork, and he says, you need to have better systems in place. Now, folks, I've been an Army officer. I've been an infantry officer and a paratrooper. I knew all about systems and everything, but I just ignored them in my practice because guess what? I figured my skill as a therapist, my manual therapy skills, my exercise skills were going to get me through. And folks, I can tell you guys the same thing. Your skills are great, but you have to have systems and frameworks in place. Now, let me make sure you understand. I've talked about being a physical therapist and talked about aspects of healthcare practices. As a medical exercise professional, from the beginning, when we started the medical exercise specialist, your job as a medical exercise professional is to provide safe and effective exercise to those clients after medical care is over. Preferably, you'll get a referral from the physician, a written referral that says the client is being sent to you for medical exercise training services or functional conditioning. But your job is not to try to compete with the therapist or provide any aspect of therapy or treatment. You don't have patients, you have clients. And I want to make sure that's clear because as you start implementing this operating system so you can communicate better with the medical community, manage your practice better, get more clients in, make better profits, scale your practice by bringing in more people, it requires that you always work within your scope of practice. I think with the proliferation of certifications we're seeing, not a lot of organizations are very clear to you on what your scope of practice is. And that's part of this MedExPRO operating system. Now, this video goes along with a blog post that may be down below. And there's a link someplace on the page where you can read the full blog post as well as some of the follow-ups we'll have and some of the podcasts we'll have. And for 2026, we're going to dedicate ourselves here at the Medical Exercise Training Institute to helping you build stronger and better practices. Folks, you got enough certifications. We've certified people out of the wazoo in the fitness industry. You know a million ways to do a leg press, to strengthen a quad, to enhance lumbar flexibility and stability. Great. You now have to learn how to run the practice, how to communicate effectively with the doctor, therapist, and chiropractor. That's what this operating system is all about. Now, you can see with the operating system, we're talking about three distinct areas: client, practice, and enterprise. If you don't mind, let me tell you about these frameworks. Now, frameworks are designed, they give you something to work within. So you have an understanding of how to put the pieces together. It's the framework. It gives you boundary. It gives you components within the framework that you can work on. And I'm going to explain these three major frameworks as well as a couple other things. So hold tight here. Now, the reason all of this is important, why you need an operating system, is because in the fitness industry, you have enthusiasm, you have intensity, and you have random exercise. And when I say random, you know how to put together the exercise program, but it's not all evidence-based. You're enthusiastic, you maybe don't have the systems, but over on the medical exercise side, you have to have an infrastructure that includes these frameworks. You have to have evidence that shows the exercise you're doing with the client is actually producing a great outcome. And everything on this side of the aisle, when you start working with the medical exercise client and communicating with the medical community, you have to produce outcomes and you have to prove your outcomes. That becomes important. So we have to look at standardization, legitimacy, and outcomes. And folks, this is all about outcomes. I mentioned something earlier about the idea of a business. And a business is always trying to acquire new customers, bring new customers in, which is great. But a practice also is based on the idea of past customers coming back or referring people for your services. I have a little story I'll tell you. And years ago, I had a doctor, optometrist in the state of California where I was living. I was in Sacramento, California. And by this point, I had sold my PT clinic, so I was in Sacramento, and I had an eye doctor that I would go to every year for my eye exam. Well, this was a great guy, and he was a wannabe golfer like I was. And I would sit in the exam chair when I came in, and we started talking about the masters and everything else. And his office assistant would literally have to come in and knock on the door and say, "Hey, boys, you guys need to go ahead and finish the exam." But he was just a great guy, and I would see him every year for that follow-up exam. Just a great guy. Well, one time I flew to Toronto to do a medical exercise specialist course. It was about 2 weeks after I had seen him and got my contact lenses, and somehow or another I had developed an infection. I called his office from Toronto. So I said, "Hey, doc, I've got a problem with my eye. Here's what's going on." He says, "Not a problem." He got an idea what it was. He says, "Not a problem. Let me make a couple phone calls and I'll call you back." Well, about 30 minutes later, he calls me back. He says, "Look, there's a guy in downtown Toronto on Bloor Street. He and I went to optometry school together. Go see this guy. He'll get you all taken care of. He'll get a prescription for you, some drops you can put in your eyes. It'll clean up the infection because you don't want to wait until you get back to California for that." That was amazing. That was fantastic. He gave me the outcome I wanted. And I don't know where the guy went to optometry school. I don't know what degree he had. I don't know where he finished in his class, but he gave me the outcome I wanted. Folks, it's not about your certification. Clients aren't going to ask you where you went to school, where you got certified. They care about outcomes, but that's the same thing with the medical community. They're not going to ask you about your certifications, and most of you lead with the marketing to medical professionals with all the certifications you have. They don't know. Let me ask you this. The last time you went to an orthopedic surgeon for a sprain or a strain or a fracture, did you ask he or she if they were board certified in orthopedics? Did you ask them when they went to medical school, or did it just come up in conversation? But you got the outcome you wanted, didn't you? Yes, you got the outcome. You were able to get back on the court or back on the field or back to running within a reasonable period of time, and you thought that doctor was great, and guess what you did? You referred other people to him or her. That's how it works, folks. And with that doctor, if he referred or she referred you on to a therapist, they corresponded periodically. In the healthcare community, you have to correspond either digitally or with paper because everything in healthcare is about a paper trail. It's one of the issues that we have to deal with because of the liability. We want to prove what we've done and we want to document what we've done. So we're going to talk about this operating system. But within this operating system, you've got to have an infrastructure. You got to have evidence for what you're doing, and you've got to produce outcomes and document them. So hang tight. We're going to talk a little bit more about this. The first framework that we talk about in this operating system is the MES Enterprise Framework. This is the framework that really covers the aspect of business, how you do business. Now, I know for many of you, you're solo practitioners. You're trying to get enough clients just so you can pay the bills, have some extra money, and move forward and get to a certain income where you can be comfortable. And you talk about hiring other people at some point, and that's a great idea, but you have to have a little bit of a different mindset. So this MES Enterprise framework is the idea, its purpose is it governs high-level business, financial aspects, ethical decisions to ensure that the practice is always viable. There's a shift that occurs, and that shift moves the professional from a technician, I'm just providing exercise, working with these clients, producing outcomes for them, to now I'm an owner building an asset. Your practice is an asset. Your referral sources are assets. Yes, your equipment, your staff members are all assets, but the practice itself, the goodwill the practice has, and the number of clients that are coming in the door, one day when you're ready to retire and you're about to sell, that's what sells for you. It's not the bricks and mortar. It's the goodwill. It's the clients that are coming to you over time. And please remember, these are clients. They're not patients. You're not providing any therapy services or treatment. You're providing exercise. And that becomes important that you stay within your scope so you don't have a problem with a doctor, therapist, or chiropractor. And lastly, why this matters, it ensures the practice survives, scales without depending solely on your personal hustle. Now, I know most of you are one-on-one medical exercise professionals, and you're out there hustling every day. You're disappointed when you send that letter to the doctor and he or she doesn't reply, aren't you? You're disappointed when you can't get in touch with them and you go by the office a number of times and no one answers your call. With these frameworks, we're going to give you something that will allow you now to move away from that idea of a personal hustle to now more of a systematic practice-based hustle, so that now you get more referrals and now people understand you and know you in the community, and you've established relationship with medical providers, not in person, but by providing documentation that they get to know you. Now, let me tell you a little story about documentation. Now, many of you know I went to Howard University in Washington, D.C. I'm a proud Howard Bison. With that, when I graduated, became an Army officer. I was young and dumb and became a paratrooper for a while. So I didn't do PT in the Army, but when I got out of the Army, I went back and started practicing physical therapy again at Howard University Hospital. Well, I practiced there for about 2 or 3 years and decided I wanted to go out on my own. Well, I had done some work locally with some of the professional teams. I got board certified in sports and orthopedics and all that kind of stuff. And it was all great. And what I did, I went out on my own, and folks, I was a hot mess. I couldn't get the administrative stuff done. I could get nothing done. And one day my mentor came by and sat me down and said, look, let me explain to you how this all works from an administrative and from a process and system standpoint. Wow. That was great. I thank God for him. His name was Kermit Gresham. Great guy. And I owe Mr. Gresham so much that allowed me to build practices later. Well, he educated me on these frameworks, and it made a huge difference. And with the frameworks, you could be a great clinician. You could be a great medical exercise professional, but you have to have frameworks and systems in place. Let's keep going. Framework number 2, the MES Practice Management Framework. This is how you manage the practice. Now, the enterprise was the business side. This is now the practice manager. This is operations, the infrastructure. This is all the structure that goes on, not directly related to the client, but everything that revolves around managing that client from an infrastructure standpoint. So this translates into a strategy for consistent, repeatable daily operations mirroring healthcare disciplines. Now, you're not providing healthcare services, but because you want to live in their world and get referrals and be aligned with them, you have to have some things that are similar to what happens in healthcare, which means you have to have systems for clients coming in the door, documenting, communicating with doctors, therapists, and chiropractors. Well, it's not guesswork. Well, today I'll send Dr. Smith a letter, but there's a system in place that at the end of the assessment, within 72 hours, you send the doctor a report that says, here's our assessment summary, here's what we're going to do. Every 30 days, you send a progress report to the doctor that explains the progress the client has made from the functional standpoint, but it also says you're documenting everything you're doing. So if that client ever wants to deal with an insurance carrier, guess what? You give them the necessary paperwork. They now can deal with the insurance carrier, but this paperwork isn't happenstance. You have a system of getting it done where you document what was done, the intensity, the outcomes. You have functional outcome measures that you can use to show the client is getting better, so the client can get paid back for the money they've given you. You have to eventually make your practices referral ready and reimbursement ready. So that's the practice management framework. And this mechanism allows you to replace the idea of memory-based tasks where you're trying to remember everything in your head or on your cell phone. It now becomes system-driven. And why this matters? This makes your practice, as I said before, referral ready, even reimbursement ready, and defensible in ensuring that it's consistent regardless of who's working in your practice. Folks, you want to take a vacation. You want to go off someplace. You want to go to a tropical island or go skiing or go hiking, and you want to get away for a while. And if you want to hire staff members, you have a practice management system or framework in place. That leads us to number 3, our MES client management framework. Now, this framework, as is outlined in the article, this framework is the execution and the outcomes. This is where you're going to live most of the time, providing services to your client. So here, this governs the client life cycle from medical clearance to functional independence. Remember, folks, your job is not to give the client a great workout. Your job is to improve the client's level of function because they came to you because they have a functional deficit left over from the physical therapy, chiropractic, or occupational therapy treatment. The insurance ran out. Now the doctor refers them to you to get them back to where they were. An example, Mrs. Smith has had a hip replacement. Mrs. Smith, let me change that. Mrs. Smith has had a knee replacement. Mrs. Smith wants to be able to wear her high heel shoes to her son's graduation ceremony. Whoa, she hasn't been able to do that after physical therapy, which was only 12 sessions. She can't do it. She keeps bugging her doctor. The doctor finally sends her to you, and you now work on improving her knee stability and strength to get her to the point she can wear those new high heels with that new outfit that she purposely picked out for her son's graduation. That's what medical exercise training is all about. It's about getting them to that next level of function that the therapist can't do because they're handcuffed because the insurance reimbursement doesn't allow them. You now become the next logical step in that chain of services so that now they're referred to you by the doctor or the therapist. You now can apply your practice, your client management, as well as your practice management standards so that now you produce an outcome. Now, this ensures that the exercise is specific dose-based modality. So the exercise is a dose-based modality. That is the only modality you use. You don't use massage unless you're a licensed massage therapist. You don't use electric stim. You don't use ultrasound. Your modality is exercise, but it can deliver measurable outcomes. This is important because we have to now start looking at this idea. Exercise is the most important modality. After all the treatment, all the services are older, we've got to keep our clients independent and viable, and that becomes vitally important for the medical providers, the healthcare system, as well as for insurance carriers. And that now leads us to our 10 practice management systems. Now, it's interesting. I learned about practice management, and practice management systems in healthcare are very similar to the practice management systems you're going to use in medical exercise or medical fitness. These systems are the daily drivers of your operations. And you may not ever thought about it, but you have systems in place in each one of these areas. You have an operations system that looks at the daily workflows and risk management, as in if you have your own facility, you don't want a water leak in the middle of your gym so someone can slip and fall. You don't want faulty equipment. So that's the operations system. Client management systems include intake, engagement, transition. It's the exercise programs themselves. The assessment system is condition-based or condition-informed screenings and assessments. So the assessment is based on the client's condition and the region of the body that's affected by that condition. Documentation system, this is having defensible records and reporting and documenting all this stuff in a timely, appropriate manner, following HIPAA guidelines, because even though you're not a medical provider, you still are communicating with medical providers. HIPAA becomes important. Communication system. This is a provider and stakeholder correspondence. What I mean by stakeholder, the doctor, the therapist, and chiropractors are all stakeholders and providers. Along with this, the insurance carrier, the client themselves, they're all stakeholders, providers in all of this stuff. And you've got to make sure that you communicate with them and show them exactly what you did, show them the outcomes you're getting so no one can question what it is you're doing. That now etches you in the mind of the doctor, therapist, or chiropractor. Folks, I can tell you, most doctors and therapists aren't going to remember what you say over the phone. They're going to remember what came over the fax machine or email or a letter, a hard copy letter. They're going to remember that because they're going to read it, sign off on it, and put it in the client's chart. So even though you send the report to the doctor, to the therapist, they never respond. I guarantee you they read it because by law they have to read it. It was filed away in the client's chart, whether it was digitally or hard copy. They read it. They just don't have time to contact you every time and tell you, that was a great report. They don't have time for that. They just simply take it and they keep moving. Next, also, we have a marketing system. This is helping you ethically position your practice and make it distinct. And a lot of marketing is just trying to get new clients in the door. You want to tell clients about the outcomes you produce. Tell them about some of the stories that you've gotten from other clients, some of the testimonials, and the great outcomes you've produced for them. Medical relationships systems. This is developing referral relationships. Now, folks, I may have mentioned this before, and please forgive me. I had one doctor in the District of Columbia who referred to me for almost 10 years. Never met the gentleman. Knew his name, he knew my name. We talked on the phone occasionally. So when I went back a few years ago for the retirement ceremony of the chairman of the department at Howard University, these gentlemen were friends. Well, at the party that evening, he walks up to me and says, "Are you Mike Jones?" And I'm like, "Yeah." He says, "I'm Dr. Sullivan." I'm like, "What?" Folks, he had referred patients to me for almost 10 years. During that 10-year period, we corresponded probably 95% of the time, and maybe occasionally a phone call. But that relationship, he remembered me some 15, 20 years later, and I was flattered by that, but it made me realize that the documentation and the communication is what really sets the standard with the medical community. Because for us, everything is based on documentation and communication. Staffing and education system, you have to have training standards and a training process when you bring new staff members on. You can't expect just because they're certified, they know what to do. They have to learn how to do it in your practice. This is where it becomes important that you write things down. You put things in a staffing manual so that everybody can follow those guidelines, and every once in a while you update them. You also have to have a billing and scheduling system. You have to be reimbursement ready. Now, that doesn't mean you have to deal with the insurance carrier yourself. It means you have to have the ability to provide to the client a super bill or the charges that were entered that day for the client, as well as documentation, a training session log or a progress report that you can provide to the client so they can deal with the insurance carrier and maybe get some level of reimbursement. And then lastly, business development system. This is important because with the business development system, you now have to have a system to go out there and get new referrals, but also to continue communicating with the current referral sources, as well as continuing to develop goodwill amongst your clients so they'll keep referring people to you. It's not about getting new clients. It's about getting referrals from those old clients and getting referrals from the old referral sources. That becomes the key for a medical exercise training practice. Now, we also have a 6-point client management system. So those systems that we just talked about, the frameworks, are vitally important, but for every medical exercise practitioner, you have to have a 6-point process that you run through your mind every time a client comes in the door. So that first thing should be, client comes in and says, "I've had a total hip replacement." You should understand the related anatomy and pathology of that client's condition. Number 2, you should immediately understand the contraindications, the red flags, the things that you don't do with the client. Number 3, you should understand how to assess the client. What are the appropriate things to assess for the client? How do you get a history on the client? And what is the 11-point screening that you do to make sure the client is appropriate for exercise? Just because the doctor told them to come doesn't mean they're appropriate, nor does it mean you're hell-bent. You have to see that client. Number 4, the indicated activities or exercises. These have to be defensible, as in, I selected this exercise because for this particular client, based on the assessment we did and based on what their functional limitations and needs were, we needed to work on this so we could get them to this point. Number 5, the progression. How do you progress the client? Is it based on a criteria, and are you looking at functional outcome measures that you can actually gauge and measure and report and share with a doctor, therapist, or chiropractor, or give to your client so they can share with their insurance carrier to show that your services are beneficial and the insurance carrier will reimburse them. And lastly, a protocol-based approach. I know for some of you, you're doing this off the top of your head. You've been a trainer for so long, you know exactly what to do. Great, but I'm going to challenge you. There are going to be some clients, some situations where you're going to forget something. And folks, I can guarantee you, practicing for some 35 years, you will forget. Even the top surgeons will tell you that. You will forget some things. You have to follow a protocol. You have to follow guidelines. And the protocols are standardized guardrails to make sure nothing falls through the cracks, make sure nothing goes off the side of the road. So this is the thought process. This is a 6-point client management system that should always be the underlying subliminal thoughts you're having when managing your clients. And one other thing, don't ever feel too professional that you don't ask yourself periodically, did I miss anything? Is there anything I'm missing with this client? Did I forget anything? Because periodically, folks, you have to be your own greatest critic and ask yourself that question, especially if you're the owner of the practice. I guarantee you your other staff members aren't going to ask you if you're the one that signs the checks. And then with that, this all is an operational imperative. Why this system is non-negotiable? It's non-negotiable, folks, because it produces consistency, it's reimbursement ready, and it's the trust currency. Documentation is the thing that builds trust with the medical community. If you document, that will give you referrals, but those referrals and medical necessity and functional outcome measures that you actually measure will eventually allow you to get reimbursement ready so clients can get reimbursed. And if you have consistency, this system moves the practice from a personality type practice where it's all based on you and your great personality and your great biceps or quads or whatever it is, to a process that now is a practice dependent. It's based on the outcomes you produce, your professionalism. That becomes important. So what we hope you get from this is these takeaways. Architecture over enthusiasm. Now, success with medical conditions requires a standardized operating system, not just creativity. You got to be creative, but you got to have a direction you're going and a roadmap. Number two, documentation is currency. Notes are proof of value and the primary method of communication with doctors. Now, folks, I'm going to tell you, we do not recommend you use SOAP notes. We highly recommend you use training session logs. The reason I know this, for years, I was a reviewer for insurance carriers as a physical therapist. If we got anything that came in from non-licensed providers, such as fitness facilities that were trying to get reimbursed for something, and they gave us a SOAP note, immediately we tossed that in the trash. Because for a SOAP note, the first thing we looked for was the license that was included on the 1500 billing form. And if there was no license number, if there was a SOAP note, we automatically tossed the file. The reason, the SOAP notes are not necessarily only for medical providers, but that's who it's usually for. In an insurance carrier, it causes confusion. So I recommend you go over to postrehab.com, try to find out information on what we call our training session log. If you go there, we have a number of forms that you can purchase that will be personalized to you, and use a training session log. If you ever deal with an insurance carrier, a doctor, a therapist, a chiropractor, I guarantee you they will love reading the training session log. It's clearer, it's more specific, it's more direct. You'll get far greater mileage out of that. And then lastly, scope is sacred. Link in the care continuum. What this means is you're never diagnosing, but managing medical conditions through exercise. Folks, you don't have to diagnose to be important to the system. You don't have to provide any treatment to be important to the system. The healthcare system now is starting to realize exercise is the key to long-term management, especially now with all the baby boomers. We need exercise more so than any other time in our history. So you don't have to worry about trying to do any treatment. You don't have to worry about trying to pass yourself off as a medical provider. The medical community is starting to understand the importance of medical exercise training, but it is important you put these frameworks in place. You have an operating system that's beyond what you have up here on your cell phone, but you actually have systems in place. So with this idea of implementing a system, your next steps, this is what you need to do moving forward. Adopt the identity. Shift, make that mind shift, and make your language immediate. You are a provider, and you're providing and managing medical conditions with exercise. You're not a trainer selling workouts anymore. Number two, install the .com workflow. What this means is use the intake forms and send 30-day progress reports to physicians and therapists to start to build their trust. Folks, they may never call you and say, oh, that was a great report you sent me. You should get a Pulitzer Prize. But what they will do over time, they'll start referring. Now, you got to give them a little bit of a break. They're busy all day long with 50, 60, 70 patients. Give them a break. And then if they're a surgeon, they're going to surgery every day, they're doing follow-ups in the hospital, give them a break. It may take some time, but keep sending those progress reports. And lastly, here's an option that will really help you. Join our enterprise cohort. We have a cohort coming up on February 28th. It's a 90-day program that will help you put all the systems in place necessary to build a strong and profitable and professional medical exercise training practice. So you can take a break every once in a while. You can hire other staff members, and it still flows and does everything well. And I guarantee you, it'll help you get a couple of referral sources. It'll help you change your pricing structure, and I guarantee you, it'll help you become more profitable. Now, our next cohort starts on February 28th. Okay, so it's coming up here soon. Look down below, click the link, get registered, or email me at drmike@postrehab.com if you have questions. But the key thing that we want you to get from this is the idea of a MedExPRO operating system. You have to have an operating system in place, and an operating system that's not one that only you understand, but an operating system that if you bring in staff members, eventually your practice grows. You need to have a receptionist that everyone understands, everyone can work within, and everyone can communicate to outside sources, including clients and medical providers, even insurance carriers sometimes, and it all works well in a professional manner. It's not all based on you, so you can never get away for a weekend getaway or a week of vacation. No, you need to take that week of vacation, but you have to put the systems in place. And folks, I can tell you from my own experience, you better put those systems in place. You can be the greatest in the world at the exercise. I always thought I was a great therapist, but I realized without the systems in place, it did not make a difference. So please, if you would, read the article down below on the MedExPRO operating system. We have a number of follow-up emails, as well as a follow-up podcast and a couple other things that you might want to pay attention to that will be helpful. And over the course of this year, 2026, we're going to do more to help you build your practices, help you put the infrastructure in place, as well as still holding our Advanced Medical Exercise Specialist Workshop, our Medical Exercise Specialist Workshop. We're going to give you the skills necessary and the certifications, but we want to move you farther along because, folks, now more so than ever before, you have to have the frameworks and the systems in place to have a viable practice that the medical community feels comfortable referring to, and more importantly, recognizes as being professional and will refer clients to. So with that said, remember this, they're not referring because they don't see you, they don't understand you. They may be referring to you because they don't quite trust you yet. That's what the cohort is all about. So all the best. Thank you for watching. Have a great remainder of the day or remainder of the evening. If you have any questions, email me at drmike@postrehab.com, but go down below and get registered for the cohort. We're only taking 8 participants for this guy. All the best.